Welcome to Sato Carry Online Nursing channel. In this video, we are going to discuss 25 important questions for the upcoming RRB Nursing Exam 2024. The first question we are going to see in this video is the ejection of milk by breast is known as option A, galactokinesis, option B, lactogenesis, option C, mammogenesis, option D, galactoria. The right answer is the injection of milk by breast is known as lactoria, also known as galactoria. Now let's see the second question. The type of abortion in which fetus is dead is known as option A, inevitable abortion, option B, septic abortion, option C, missed abortion, option D, threatened abortion. The right answer is missed abortion. Option C, missed abortion is the right answer. Question number 3. A client is born with suspected esophageal atresia. Which of the following investigation is the most appropriate in the first instance? Option A, chest X-ray. Option B, nasogastric tube and chest X-ray. Option C, abdominal ultrasound. And option D, give 10 ml of contrast and chest X-ray. So when a child born with esophageal atresia, the first investigation to be done, which will be appropriate, should be nasogastric tube and a chest X-ray is taken simultaneously. Question number 4. Spalding sign in X-ray is seen in option A, intrauterine death, option B, intrauterine growth retardation, option C, preterm pregnancy, option D, twin pregnancy. The Spalding sign is the main feature of intrauterine death. Option B, intrauterine death is right answer here. Move on to fifth question. On what basic principle the heat exchange is occurring in an infant incubator? Option A, evaporation, B, convection, C, conduction, D, radiation. The principle behind heat exchange in an incubator is option B, convection is the right answer here. Next, the most common cause of meningitis in children below 3 years of age is option A, pneumococci, B, meningococcus, option C, Haemophilus influenza, option D, group B, streptococcus. The 3-year child can get meningitis. The most common causative agent is option D, group B, streptococcus is the right answer. Move on to next question. What do you mean by fetal macrosomia? Option A, preterm baby. Option B, baby with large size eyes. Option C, large size baby. Option D, baby with malformation of stomach. The right answer for fetal macrosomia means option C, large size baby. Option C, large size baby is right answer here. The next question. Time lag for maximum therapeutic response after initiation of fluoxetine hydrochloride is option A 3 weeks, option B 1 month, option C 1 week, option D 2 weeks. The therapeutic time period for the action of fluoxetine hydrochloride is option A 3 weeks is right answer. Move on to next question. Pentavalent vaccine or 5-in-1 vaccine. It can protect against option A, diphtheria, pertussis, tetanus, hepatitis B, and HIV. Option B, diphtheria, polio, tetanus, hepatitis B, and HIV. Option C, mumps, pertussis, tetanus, hepatitis B, and HIV. Option D, diphtheria, pertussis, rubella, hepatitis B, and HIV. The pentavalent vaccine contains the five different vaccines. In one vaccine, we have five different vaccines for option A, diphtheria, pertussis, tetanus, hepatitis B, and HIV. Move on to the 10th question. Disulfiram therapy is indicated in option A, nicotine dependence, B, alcohol, acute intoxication, option C, cannabis intoxication, option D, alcohol dependence. Disulfiram therapy is indicated for treatment of alcohol dependence. Option D is the right answer here. The 11th question, the time required to measure the Montax test. Option A, 24 to 48 hours. Option B, 24 to 36 hours. Option C, 48 to 72 hours. And option D, 10 to 12 hours. Montax test is done and waiting for the result. The time period is 48 to 72 hours is right. Option C is right. Question number 12. The normal human body temperature is maintained by option A, carbohydrates, B, protein, C, vitamins, option D, fat. The normal human body temperature is maintained by the nutrient. The fats is the right answer here. On to question number 13. Which symptom most likely to alert the mother of a child with suspected diagnosis of Hirschsprung disease? Option A, foul smelling ribbon-like stool. Option B, regurgitation of feeding. Option C, projectile vomiting. Option D, diarrhea. The child with Hirschsprung disease shows the warning sign as option A, foul smelling ribbon-like stool. How are ECG changes presented in ischemia and myocardial infarction? Option A, ST segment depression. Option B, as a small Q wave with an elevation in the ST segment and a peak or inversion in the T wave. Option C, as an elevated PQRS. And option D, as a larger Q wave and P wave. So during myocardial infarction and ischemia, the changes noted in ECG will be a small Q wave appears with an elevation in the ST segment and a peak or inversion in the T wave is the right answer. Move on to question number 15. What is the capacity of a neonatal resuscitation bag? Option A, 150 to 300 ml. Option B, 300 to 500 ml. Option C, 250 to 300 ml. And option D is 250 to 700 ml. The right answer, the capacity of a neonatal resuscitation bag is 250 to 300 ml. Option C is right. Question number 16. The percentage of fetal hemoglobin (HbF) in fetal red blood cell is option A 20 to 40%, option B 65 to 90%, option C 40 to 60%, option D 45 to 65%. The right answer, the percentage of fetal hemoglobin in fetal red blood cell is option B 65 to 90%. Question number 17. Isotope of cobalt is used in the treatment for which of the following diseases? Option A, goiter, B, AIDS, C, anemia, D, cancer. The isotope cobalt is used for the treatment of option cancer is the right answer. Question number 18. The surgical removal of the entire contents of the orbit, including the eyeballs and eyelids, is known as A. Evisceration, B. Extemporation, option C. Craniotomy, option D. Exentration. The surgical removal of the entire contents of the orbit is known as option D. Exentration is the right answer. Move on to question number 19. What are the maternal physiological changes during pregnancy? Option A, increased heart rate. Option B, decreased vascular resistance. Option C, increased cardiac volume. Option D, all of the above. So, what are the various changes occurring during pregnancy in a maternal physiology? The right answer is all of the above. There will be increased heart rate, there will be decreased vascular resistance, and also increased cardiac volume. So the right answer is all of the above. The next question. A 6-year-old child has been admitted in a pediatric medical ward as a case of malignant tumor. Which one of the following is the most common in the above age group? Option A, chronic myeloid leukemia. Option B, acute lymphoblastic leukemia. Option C, acute myeloid leukemia. Option D, juvenile myeloid leukemia. The most common type of malignant tumor in a 6-year-old child would be option acute lymphoblastic leukemia. Question number 21. A 15-month-old child is brought to the OPD with diarrhea. He has sunken eyes, the skin pinch goes back slowly, and he drinks eagerly. As per the integrated management of neonatal and childhood illnesses, this type of diarrhea is option A, mild dehydration, option B, no dehydration, option C, severe dehydration, option D, severe persistent dehydration. So the right answer, the type of diarrhea as per integrated management of neonatal childhood illnesses would be severe dehydration. Option C, severe dehydration is the right answer. Question number 22. Which one of the following method is best for psychomotor skill development among students? Option A, lecture method, B, demonstration, C, role play, D, group discussion. The best method in development of psychomotor skill among the student would be option B. Demonstration is right answer. Question number 23. The arteries which primarily feeds the anterior wall of the heart is option A. Circumflex artery, B. Internal mammary artery, option C. Right coronary artery, option D. Left anterior descending artery. The type of artery which is supplying to the anterior wall of the heart is the option D. Left anterior descending is the right answer. Question number 24. In Freud theory of personality, option A, the id operates by secondary process. Option B, the ego obeys the reality principle. Option C, the superego obeys the pleasure principles. Option D, the ego operates by the primary process thinking. So, in Sigmund Freud theory of personality, the right answer is the ego obeys the reality principle. The 25th question and the last question in this video, the first aid management of acid burn injury is option A, to inform the police, option B, elevate the affected part, option C, Cool the burn under cold running water for at least 20 minutes. Option B. Do not touch the affected part. The right answer is option C. Cool the burn under cold running water for at least 20 minutes. So here we come to the end of today's 25 important questions in RRB exam. So hope we will continue to give another 25 important questions as a second part of this video. Still that, you please stay with us, like our channel, comment on the video. Meet you soon. Take care. Bye bye.